Hello, everybody. It's a pleasure for me to share with you today the new WHO PAHO guideline for preventive chemotherapy for the control of Taenia, solium, taeniasis. This guideline was prepared in accordance with the latest WHO methods for guideline development. It included the following process. First, a guideline steering group managed the entire process. There was a systematic review group who synthesized the cumulative evidence on taeniasis and its treatment to date. There was a guideline development group who developed the recommendations that I will be sharing with you today. And an external review group looked at those recommendations and provided their appraisal for the final version of the guideline that I am sharing with you today. It's important to note that different regions of the world and expertise are represented in these expert groups. The official citation is the following. It's the WHO Guideline for Preventive Chemotherapy for the Control of Taenia, solium, taeniasis, published this year. So the systematic review group summarized the evidence to date on the following two questions, which inform the guidelines. The first question was, should preventive chemotherapy with niclosamide, praziquantel, or albendazole at any dose or frequency versus no preventive chemotherapy be used for the control of taeniasis by Taenia solium in endemic populations? And secondly, in school-age children who live in areas co-endemic with T. solium and soil-transmitted helminths, could preventive chemotherapy for both these parasites be given simultaneously? The systematic review has been published in PLOS Neglected Tropical Disease last year, and of course is available to all of you to look at. The recommendations that I am going to share with you are all conditional, and they're conditional because in the systematic review, the evidence that was summarized are consistent with having a very low certainty of the evidence. So as more evidence is gathered, further updates will be done. And this is really an important point, is that we do need research on many different aspects of Taenia, solium, taeniasis as we move forward. There are 4 recommendations. The first recommendation is that preventive chemotherapy using niclosamide at 2-gram dose, adjusted for children, can be used as a public health intervention for the control of Taenia, solium, taeniasis in endemic populations. That's the first recommendation. The second recommendation is that preventive chemotherapy using praziquantel at 10 milligram per kilogram body weight can also and is suggested as a public health intervention for the control of Taenia, solium, taeniasis in endemic populations, ensuring that there is a reporting system in place with active surveillance and medical referral of neurological adverse events. The third recommendation is that if neither niclosamide nor praziquantel is available, preventive chemotherapy using albendazole at 400 milligram per day for 3 consecutive days could also be considered as a public health intervention for the control of Taenia, solium, taeniasis in endemic populations, again, only if a reporting system is in place with active surveillance and medical referral of neurological adverse events. The fourth and last recommendation is that in school-age children who live in areas co-endemic with Taenia solium and soil-transmitted helminths, praziquantel for taeniasis at the dosage of 10 milligram per kilogram body weight and albendazole for soil-transmitted helminths at a dose of 400 milligram single dose can be considered to be given simultaneously to promote synergies of the programs, ensuring that a reporting system is in place with active surveillance and medical referral of neurological adverse events. There are some subgroups that need to be considered. The first is children. The dosage of niclosamide should be adjusted for children under 6 years of age. If albendazole is to be used, albendazole for taeniasis at 400 milligram per day for 3 consecutive days should not be used in children under 30 kilogram weight. Another subgroup are people with symptoms compatible with neurocysticercosis or subcutaneous cysticercosis. These people who have these symptoms should be excluded from preventive chemotherapy with albendazole or praziquantel. It's important, however, to be aware that excluding people based on symptoms doesn't necessarily address the potential risk of precipitating neurological symptoms in individuals who have asymptomatic neurocysticercosis at the time of treatment. Another subgroup that must be considered are those of pregnant women, including pregnant adolescent girls who are in their first trimester of pregnancy, or women who are suspected to be pregnant. These women and adolescent girls should be excluded from preventive chemotherapy for taeniasis with any drug. The following implementation considerations are also important. First of all, the scope of preventive chemotherapy should be considered for the entire community, not for just a part of the community, but the entire community. So the program really must be inclusive of the entire community. With respect to food and drink, praziquantel and albendazole for taeniasis should not be given with food. So ideally, these drugs should be administered at least 2 hours since the last meal and 30 minutes before the next meal. Praziquantel and albendazole should also not be given with grapefruit juice. There are some considerations with respect to the choice of drug. So the choice of drug for preventive chemotherapy for taeniasis should consider the presence of other co-endemic diseases that might benefit from the preventive chemotherapy program that is being implemented. The choice of drug also depends on drug availability, acceptability, affordability, and feasibility of implementation. And keep in mind that some drugs for preventive chemotherapy for taeniasis may be available through WHO, and you should inform yourself of this case. The choice of drug should also be informed by epidemiologic mapping of cases based on both animal and human surveillance data. With respect to adverse events and reporting, active surveillance of adverse events should be conducted for at least 3 days following preventive chemotherapy for taeniasis with either praziquantel or albendazole. That is 3 days after the last dose that has been administered. And this should be followed by passive surveillance for another 7 days. The people in the healthcare system at the community level need to be trained in the recognition, reporting, and management of neurological side effects. In this regard, the National Program on Epilepsy and other epilepsy initiatives could be included as collaborative partners to undertake this training. Routine data collection procedures are required with respect to the standard reporting of coverage of the preventive chemotherapy program. This reporting should, at a minimum, be disaggregated by age and sex. With respect to messages to the community, preventive chemotherapy with any drug should be accompanied by the relevant information, education, and communication about adverse events. And of course, WASH messages, water, sanitation, and hygiene messages, especially with respect to the safe disposal of feces. Lastly, preventive chemotherapy delivery can occur in different community facilities, health centers, schools, or other appropriate facilities in the area in which the program will be implemented. And it is hoped that it could be integrated with any other public health intervention that is going on at the same time. Lastly, the research agenda is very important in order to ensure that these guidelines reflect the current state of knowledge. So with respect to diagnostics, it would be important to develop and validate new, affordable, sensitive, specific, and field applicable diagnostic tests, and to be sure that these are compared so that this can inform the best practice in the field. With respect to preventive chemotherapy implementation and delivery, it would be important to confirm and to establish thresholds to trigger the start of a preventive chemotherapy program and to end it and also the frequency with which it should be implemented in an area. It would also be important to have some qualitative studies to identify best preventive chemotherapy practices to ensure effective program implementation. With respect to efficacy and safety of the drugs, there is still a need for high quality randomized controlled trials of different drugs, different doses, and different combinations of drugs. There should also be some study about the optimal observation times for active surveillance for adverse events. With respect to assessment, there should be an economic evaluation of the preventive chemotherapy program and acceptability issues related to the program, which would benefit all stakeholders, including the community. Thank you very much. This is the new guideline for the preventive chemotherapy for the control of Taenia solium taeniasis. Thank you.